r/AskReddit. Doctors, what patient made you go, how the hell are you even alive? Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation. Diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg/dl. Normal is 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64-ounce sodas and candy bars into the hospital, literally 1 week after we chopped her foot off because of uncontrolled diabetes. My wife's father died due to diabetes complications. He'd been in and out of the hospital for several years. He went in on a Friday, they amputated toes on Sunday, he was dead on Monday. Nobody was prepared, but nobody was surprised either. When we went to his apartment to clean it out, and there was candy everywhere. Under couch cushions, pillows, in his bed, in all of the cupboards. I have a sweet tooth and I can't imagine wanting this much candy. The man killed himself. I have gotten my sign to stop. I like my toes and my life, and have a huge history of family with diabetes. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. A friend of mine had to get his entire leg amputated because he slipped off the bottom step of a ladder and bent his knee backwards. It apparently pinched some type of main blood vessel as his entire leg eventually got necrosis when they had him in the hospital. They tried to helicopter him to some other hospital, but there were high winds, so they had him sitting there with the necrosis spreading. Over a stupid 1-foot slip. We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw, and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s. He was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 AM and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile he's so coherent and alert, as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious, or would already be dead. They swooped him off to surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the ER, because I think it just reminded me that hope and good outcomes are still out there. My favorite bit about this story is you called someone in their late 40s, a young guy. As feel good as this story is, you've just made a bunch of other random people very happy. When I turned 30, my little brother told me, don't worry about it, if your life was a Wikipedia article you'd still be in the early life section. That actually helped a lot. I was on home call for ER in a small town, got a call from the ER nurse one night, and she was like, EMS brought someone in here, and they think she might be dead. I was like, well, is she? She was like, I don't know. This was a seasoned RN, by the way, so I was like, well, guess we are treating this as a code blue kind of situation. So without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch, so I opened their eye, and a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1, for those familiar with lab values. The backstory was extreme self-neglect / depression combined with carriage over neglect. Weighed in at 67 pounds at a height of about 5 feet 5 inches. We actually resuscitated her, very aggressively and unbelievably. After about 8 liters of fluid, she started speaking a word or two at a time and recognized her daughter. For those like me who are curious, potassium levels between 3.6 to 5.2 is normal. Anything less than 2.5 is life-threatening. Seems like a relatively wide range for normal, but it doesn't take much to get into deadly territory. That's kind of scary. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head. Essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial cord scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my IQ rotation and I see this guy awake and conscious. Pretty crazy. Any update on his condition? Crazy. When I last saw him, we were basically seeing how much function he would get back, but he was going to be in the IQ for a long time. From what I can remember, he couldn't really move either leg, but he actually had some movement in his arms/hands, so they weren't sure how much he was going to get back by the time he left the hospital. During residency, my IQ patient had to have his chest reopened less than an hour after 6-hour open heart CABG surgery. He needed 12 units of blood, his heart massage then shocked 4 times. Cardiothoracic surgeon and the IQ operating, because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult ENT to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24 I believe, at 6 AM, he opens his eyes. I was shocked. He has a permanent tracheostomy now, but somehow is alive. How the hell did he get maggots in his nose? I'm not that poster, but I'd assume drug abuse. I shadowed an SLP in an IQ one day, and we had to do a cognition eval on someone who had overdosed on what is chart called a variety of drugs. I forget exactly how I found this out. I think he was alert and told us, but he'd done so much cocaine that he didn't really have a soft palate anymore. It had just dissolved away or something. I'm really not acquainted enough with drugs to say for sure. My dad is 87. He had prostate, liver, bowel, colon, and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. If I were a doctor or scientist duck every 6 months, I'd want to see this guy weekly so I could study him and give other people his immortality. I don't know, man. If immortality comes with those side effects, I might pass. A guy I took care of during my residency, ducking Cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest, 3 centimeters below clavicle. He got an ER thoracotomy. If you want to feel like a badass, then do an ER thoracotomy. We were able to cross-clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib, then transported him to the ICU still intubated. 8 hours later he was extubated and wanting breakfast. Seriously, dude? He was dead 10 hours before. He was also a complete asshole. No wonder someone stabbed him. Nurse turns to the doctor, can we unsave this one? Where's unsave button? The neck. Gotta give it a good twist though. Patient here. When I was 2 I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a cord scan. This was 1990, and when they were done, they turned me back over, and I was blue, had stopped breathing. Court revealed a volleyball-size mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my rib cage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages. Everything but major organs. I made a full recovery. I'm a healthy 31-year-old now. Zero asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. What the duck? When I first read, made a full recovery, I thought you meant the tumor twin they found in your mayo. But seriously, it's wild that it continued to grow, leeching off your body. A couple pictures of me before and after brain surgeries were on the front page around this time last year. The mortality rate for acute sideral hematomas is between 50 to 90%. Of those who live, approximately 20 to 30% regain any brain functioning. Due to the sideral hematoma, the bleeding in my skull was so severe that I also had cranial herniation. My brain tilted 5 millimeters, causing my brainstem to compress into my spinal cord. That I not only lived, but woke up and recovered well enough to go back to work, get married, travel the world, return to baseline physically is a straight up medical miracle. I'm still in touch with the neurosurgeon who was on call at the hospital that day, and he says the same thing. When my mom was in her ER cycle during internship, man with police officers behind him came in the ER. The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues that they rescued a patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. My siblings and I all walked away from a car crash where our hatchback flipped upside down and backwards on the highway. Car was totaled. Ambulance guys couldn't believe we'd walked out of it. Seatbelts save lives. Currently in residency, but this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery, who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. Airlifted pregnant female with gunshot wound to the head. Arrived intubated and non-responsive with the bullet lodged in her right occipital lobe. Self-extubated the next day and left the hospital against medical advice 2 days after that with only minor visual deficits. Unbelievable. She was no lady. She is a Terminator. More badass than a Terminator, she was Sarah Connor. Actually this makes sense. Pregnant with John, she gets shot in the head by a Terminator. She then flees the hospital before it tracks her down. Did she still have the bullet in her when she left? Yeah, that's actually a common misconception. If you get shot, very rarely do we go and dig the bullet out. The damage from the projectile is already done. Taking an individual back for surgery to remove it will likely cause more damage with, almost always, zero benefit. I'm not a doctor, but I did meet a patient who fell from a 5-story building, landed on his upper back, woke up in the hospital the next morning, and got up walking around like nothing ever happened. Barely a scratch on him. Think about it every time I'm in a building with at least 5 stories, just looking down like how in the world did this guy walk away from that like he fell off his bike and took a nap. Actually, I've seen worse injuries from someone falling off a bike. Lol. Patient here. When I was 7 I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night and found I was not breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctor said they didn't know how the duck I was still alive. Now 16 and haven't had any hospital worthy complications since. And god damn it, my mom is the most amazing and loving person on this green earth. Everything else in this thread is just incredible odds that someone somehow won. But how the hell did you wake up again? Probably had a very faint heartbeat that they didn't detect.